Hi, everybody. Welcome, welcome. We are here joined today with Katie. I'm so excited. Um, if you haven't joined us before, we just want to welcome you. It looks like we have people. I have some comments. We have Whitney. Hello, Jason, Guadalupe, Gina. We have Amy. And it looks like Gina's asking Whitney and Liz. That is such a pretty name. Um, and we're having is somebody says, is anybody else pre-op? Yes, I'm sure there is because we always have people pre-op on these calls. We have people pre-op, post-op, some people even undecided on surgery. And I'm going to kind of flip over to our Facebook page also as well because we might have some questions there. I want to welcome you if you're joining on Facebook. But for anybody who this is their first time with us, we just want to welcome you. And we have these live topics every single week. Today, our featured guest is Katie Chapmon. Katie is a dietitian that is known nationally. She actually presents at she's a speaker. And also, I mean, she still sees patients in the clinic setting. And Katie, with that, I'm just going to kind of turn it over to you because I want you to kind of tell them a little bit about yourself because today we're talking about sex hormones. And I was teasing her before this because I give her the hardest topics because I know she can do it. It's something I couldn't just whip out and talk about. But I just appreciate this is going to be such a great topic because I don't know about anybody else, but this is whenever I before working with ProCare Health. One of our biggest questions post-op was about changes in hormones post-surgery, and one of those big ones is sex hormones. So, Katie, I'm going to turn over. Tell them about you, and tell them, you are a specialist in hormones. So,
yeah,
and bariatric surgery.
I'm like, hello,
gut health, all that good stuff.
Hello, I know all the good things. So, hi, I'm Katie Chapman. I'm a registered dietitian, and I've been a dietitian for 14 years. And all of those years have been with bariatric surgery. So whether it's someone deciding if it's pre-op, if it's post-op, I've kind of seen a whole bunch of it years out from surgery. So I kind of bring that experience and that history with me. And I worked in clinics for 10 years. And then now I'm in private practice. So I still do see clients who are going through the bariatric surgery process. And then I also work with gut health and hormone health, whether that's separate from surgery or together, because I see all those themes with someone going through that surgery process of like, yep, we have surgery and definitely that happens and there's nuances to that. But we also see these other aspects and changes that can really affect someone's quality of life and aspects with that. So I guess the other things, right, that I should mention too, like, yes, I speak nationally. So some of the different conferences and education to other providers and surgeons. So I speak a lot on hormones, pregnancy, breastfeeding, gut health, and then just even like vitamin and mineral deficiencies and some of those things. And then I'm like, I've authored a couple things, a couple papers, and I kind of just try to at least stay as up to date, both on the, let's say, like the science side of everything, but then also at the same time with my lovely, client and people side of things of how do we really break down these complex topics into something that makes sense and something that we can understand. And I have to say this one today is a doozy even for me because, and Brenda's right, she gives me the complex things that I'm trying to figure out, like, how there's so many aspects to it. And I want to get to, straight to the point, but also have a really great understanding of, what those themes are and how to make it feel okay and kind of click in all of our brains. So sex hormones is one of those that, yes, they change and adjust after surgery. And, why do we see that? And maybe some of our expectations for that, and what we can kind of do to also help ourselves and help support those too along the way. And then obviously any of your questions are always welcome too.
Yes, and I want to say, it looks like I have somebody with their hand up. Looks like, and so
Okay.
if you do have a comment, instead of inviting you here on screen, what we're going to do is just take comments in the chat box, and also there's a box if you're listening from Crowdcast that is an Ask a Question feature, and if you put your questions on there, guys, what will happen is we will make sure and answer those throughout, and they will be time stamped, so that if you have to jump off the call, you'll know exactly where to go. And if you're on Facebook, just post your questions in the chat box and we will make sure and answer those as well. So I'm going to be muting myself, Katie, and then I'll periodically just check in and I'll let you know if there's some comments or anything.
Stop me. I made some slides just because it's easier to have something visual, and that kind of can help us too. So, we always cross our fingers with technology of, hey, let's take a look as far as slide wise, how we can do with the technology. And then Brenda, that makes me not be able to see you or any of the questions come in. Sure. So please just stop me.
Absolutely. There is a question as you're kind of getting ready. You can go ahead and get your slides set up and ready. It's fine.
Okay.
Lori asked, what books or online resources do you suggest to better understand how hormones change post-op?
Oh, goodness.
I
will be honest, I haven't really seen anything that is really of like hormones and surgery. Gosh, maybe I should do something.
This is all fresh.
I'm like, my gosh,
Katie.
Yeah, no, maybe I should do something.
An article or something.
Yeah, I haven't seen anything that really like dives into surgery. I like Dr. Aviva Rom, and the last name is spelled Romm, and she has a couple books. First name is Aviva, Aviva, and she has a couple books that are just about like hormones in general and hormone changes. And I feel like she kind of breaks it down really well. So that might be something to just familiarize yourself, but I don't know anything that is direct with just bariatric surgery, at least at this point. So hopefully that helps.
Yeah. Well,
I know. I'll see what I can do, you guys.
Everybody, this will be videoed. This is recorded. Okay, so you can come back using the same link as you registered for. You can use that same link, or we will also be placing this on our ProCare Health YouTube channel, so you can watch it on replay there. So if you do have to jump off or you want to watch it multiple times, do that. And also, Richard says, are these changes different based on gender and age? I think she's going to answer that because I saw her presentation.
Yeah, I am. So great question. Wonderful. Can you see my screen? Let me make sure.
Yes.
Woohoo. Okay. We did it.
First step.
First step. Okay. So let's talk through like sex hormones, kind of what we see, what changes, as I said, we see post-surgery, and kind of even what those are. So then that way, and this is kind of real quick on the slide side. So also that way we can also have some questions too, because there's so many questions with sex hormones, and I know I wasn't. There's no way to cover that vast of a subject and kind of this. So we're going to do our best here. So first and foremost, let's kind of just go through sex hormones. Let's just get real basic here. So we have some of our major players here. So we have our estrogen, which in females are those who are female at birth, is kind of considered that sex hormone is responsible for the development and regulation of the female reproductive system, menstruation, pregnancy. And then in males, that are those who are born as males, it's important that estrogen is part of that kind of nuance for balancing testosterone. And with that, that helps with sex drive. It helps with that balance to continue erectile function and sperm production. And so what we do see is that, so when someone has excess weight, we actually tend to see a bit higher levels of estrogen because of the communication with adipose tissue, which adipose tissue is just the fancy scientific term for fat cells. And I'll talk about why this happens, but so just think if estrogen is supporting these things, and then if we have excess weight and it changes the estrogen levels, then we'll have changes in these things, such as menstruation, such as potentially sex drive or sperm production. And so we see that correlation with someone who has weight and then this particular hormone. We have all of them that are kind of affected. Progesterone, our other major player. And so in progesterone, the function for females is that we see that it helps with fertility and it helps with keeping that kind of ovulation balance. So estrogen and progesterone communicate with each other, especially like women of forming that cycle. And I like to think of it as a yin and a yang. So as one goes up, the other goes down, and then they flip sides in order to accept fertilization of an egg, or if no fertilization happens, then menstruation happens. And in males, it helps with that testosterone and helps with that sperm production. We don't see a ton of changes in progesterone itself related to adipose cells. But what I can say is because progesterone and estrogen have a relationship, as we saw from this slide before, if estrogen levels have changed because of weight, then that can communicate differently with progesterone. So then you start seeing those changes. Again, I just want to kind of get, everyone on the same page since we're covering a robust topic. And then the last of our major players in our sex hormone is our testosterone. And so we see for females, bone function, sex drive, mood regulation. In our males, we see also sex drive, bone mass, fat distribution, whether that's more like abdominal or all over, muscle mass and strength. So we see all of that. And low levels with this particular hormone with someone who has excess weight, because again, of that adipose tissue interaction. Okay. And so what I kind of mean by that, and I'll go into that next, is that our adipose tissues, they start to act like signalers. Okay. So they start to kind of act within our endocrine system to start to signal to our hormones. And I always tell people hormones are messengers within our body to know what to do. So are we ovulating? Are we not ovulating? Are we menstruating? Are we having sperm being produced? All of those different communicators. And so when we have adipose cells or more fat cells, then that can start to signal these in a different way, whether it's making them go higher or making them go low. Okay, everyone with me so far, put a thumbs up, say yes. I wanted to at least get our major players there.
Okay, we have a yes, and I'm waiting on Facebook, but Two, one other thing too, Katie, that just
Yeah.
kind of came to mind as you were
Yeah.
talking about the hormones also is body hair and acne.
Yeah. Yeah. So those definitely can be part of, let's say, like symptom wise of what we may see when sex hormones are off. And they can happen for like, and I'm like, whoo, did not get in the weeds on this one. But definitely when those signals are off. So just think like, right, hormones are messengers. So if we have too high or too low of something, or they're imbalanced. So I think like progesterone and estrogen, like they communicate and then their balance is off, then those hormones, those messengers, are going to message to your body to do different things. So, let's say for example, like acne. And so oftentimes people will see that they'll see kind of a cyclical part to it. So they'll go, oh, it's okay. And then it gets worse on this week. And then maybe it gets a little bit better on this week. And so with that cyclical part of it, that's with all of those kind of like, let's say the yin and yang part and different messaging. I will say that body hair and acne can be related to a couple other things too, but definitely you're right. Like there's other, let's say, symptoms that can come up when someone's hormones are off.
Yeah, thank you.
Yeah,
It looks like
absolutely.
everybody so far is answering yes, that they're listening and are
Oh,
understanding.
yes.
Good
Great.
sign.
Okay. Good sign. As I said, I was like, gosh, I'm trying to not get in the brainy weeds with all of you guys. But that's where my head kind of goes sometimes. So let's talk about like hormones and then where our adipose cells come in. And I kind of mentioned that a little bit before, but I like to kind of dive in a little bit more of like, well, what's the signaling part of this? So if I kind of look here at like fat cell development, and I really like this because it helps us to kind of think through of why some things change and also why it is maybe potentially like why we want to kind of think about like after surgery supporting our remaining adipose tissues and supporting our hormones. And I have like a top 5 that actually can be really helpful. So like just know that like we have our little fat cell, development. And so we do actually like when we grow, we get, more of our cells and more of our fat cells as we grow as children. And then as adults, if we have where, whether it's excess intake or medication or genetics or different things that influence that fat cell. First, our fat cell starts to just grow. Okay, so the size increases. And then when they've reached their maximum that they can do at that size, and we need more storage, they break apart. And then we have an increase, we have more fat cells or more adipose cells or adipose tissue because they all kind of hang out together, which would be our tissues. And so even when we have weight loss, our cells we still have the same amount of cells. We just have shrinkage within those cells. So I think when I always kind of look at this and I'm looking at like, well, what do they do and why did these start to communicate? Is that if we kind of look back and at the beginning and we're like, okay, yep, we're growing, we're kids, we're increasing, maybe we, eat more, or as I said, like the other parts that can influence fat cell development. And as they're getting bigger, what ends up starting to happen is we start having then that become much more of a communicator within our hormone or our endocrine system. Okay. So as we break apart, as we get more cells, all of a sudden it's like, oh, we have much more of a communicator and much more of an influence. And how I like to think about it is if we have a game of telephone and we have four people in that line, and that's like our pancreas, that's these other organs, and our usual four people in that line. As we get more adipose cells and tissues, it's like we add another person into that game of telephone. So all of a sudden we have another voice, another signal, another communicator. And so that's why we see just these connections and these differences when someone has weight or fat tissue development. So this is kind of wordy and I want to break it down, but I at least wanted, because I love to have people have information. And so just think that some of the hormones are stored in those cells. And it also acts as that communicator to those adipose cells and those adipose tissues. So they, as I said, the signaling part, they'll talk to sex hormones. They'll actually also work with your metabolism too, and say like slow down or increase or whatnot. And so as our adipose cells increase or decrease in size, then that signaling changes. Are we louder? Are we quieter? And so just know that these cells are our primary, as I like kind of said at the beginning, our hormones are stored. Some of them are stored in fat cells. Our estrogen storage and what's circulating in our body is really, really influenced by adipose tissue, especially post-menopausal women and men. Okay, so men usually in above 50. So that's where that primary part is. But then also, if we look at pre-menopausal women or men below 50, adipose tissue can influence up to 50% of our circulating testosterone. So we start having, just as I said, these differences in our estrogen and testosterone. Those are the two that I see mostly influenced by our adipose tissues. Makes sense so far? I'm going to check in with you, Brenda.
Yeah, thanks for checking in. There is a couple questions actually.
I figured.
Yeah, I know. So Richard asked, what are adipose cells? And I just kind of wrote in the chat box that they were also known as body fat or connective tissue, found throughout your body, basically. And after that question, so you may want to add to that. After that, Whitney says, how do we slow down fat cells? And she also asked about, how about women with hysterectomies? There's another question, but I'm going to let you answer those first.
Oh, okay. So Richard, yes, no, you're exactly right. Adipose cells are also just your fat cells. Okay. So they're cells that store fat, and that when they're all linked together, that creates tissue. So they're all throughout our body, and they should be like they should be, just especially as we grow and develop. However, those can increase in size. And then when they increase to their max, then they break apart and we have more availability for increase. And that's how we develop more weight. So that's kind of one. And then what was the second question besides the hysterectomy? Sorry, Brenda.
No. So what were adipose cells? You answered, how do we slow down fat cells? And then the hysterectomy question.
Okay. How do we slow down fat cells? So, honestly, like you're wanting to support your body from not increasing extra energy into those fat cells. So I do look at hey, what is someone eating and how are they eating? I look at blood sugar regulation because that can signal cells to say, hey, we need to store more instead of use a little, store a little, or use a lot, store a little type thing. I'd also take a look at like medications. So there's some that are more weight promoting that that you can sit with your doctor and actually take a look and see if there's any that are weight promoting that can be switched out. And so the main things that I look at for people, and I actually will go over this at the end, is like how to support your sex hormones, but then also those adipose tissues. So really, it's not like cells or fat cells just increase like gangbusters. Okay. It might feel like that. But if over time they start going, oh, okay, I'm supposed to store. And I look at this of like, if someone doesn't eat all throughout their day and they eat mostly at night, then that tells your body, okay, how we're supposed to use this is we're supposed to store this because we don't know when this is going to happen again. And it hasn't set up the situation in your body to go, oh yeah, okay, I can use a lot of this and store a little bit of this because I know things are going to come, like fuel is going to be coming in throughout the day. So that's where I kind of look at like supporting fat cell or like growth or lack of growth, let's say. So the other thing about the hysterectomy part, I'll be honest, that's going to get a little bit more into the weeds. So I'll make this kind of almost short and sweet. So with a hysterectomy, it depends. Like some people will go on outside hormones to help be supportive. Some people won't. And like with that, then I would be like, oh gosh, you want to work with a practitioner to make sure that we have like bone development and bone support, and to almost see like what is actually, if anything, circulating, because there's other organs besides your reproductive system that can actually make these hormones too. So my short and sweet, hopefully.
Yeah, I think so. So also, so post-op, the size of cells shrink, but you can't get rid of them, correct?
That's correct.
Okay.
Mm-hmm. And that's why, like I always tell people as I go, you want to be really, really build your consistency after surgery, because you want those you want everything in your body to go, I know exactly what's happening. I feel super safe. I feel like I can be this size of my fat cell size forever. And you want to make sure that that communication is happening consistently within your body. So yeah, you don't get rid of them, but they can stay that small amount and still be functional with you and keep maintaining weight loss. Absolutely. I think I answered, I hope. So moving on.
Yes.
Okay. I was I want to make sure.
I had myself muted.
Okay. I'm going to move on and then we'll stop a little bit and kind of take some more questions. I want to mention leptin, just because of leptin is our hunger hormone. Okay. And so leptin is one of those that's made or synthesized in adipose tissue. So just think our fat cells will oftentimes make more of our hormone that says, hey, I'm hungry. Okay. And so it helps to kind of regulate appetite. And so when I kind of start looking at like leptin, and the reason why I mention it is that with our fat cells or those adipose tissue, our leptin will oftentimes be higher in someone's body. And what ends up happening is that leptin can actually affect like fertility and follicular development, which is important for fertilizing an egg. So sometimes with that we also see some of our other hormones or signals affecting not only just, sex hormones, but we also see it affecting kind of just the whole process of this. So what ends up also happening after surgery is that with that shrinking of those fat cells, we also see that lessening of that hunger hormone, or that, I would say, like that leptin, which helps control appetite. And I totally mix that up as I'm talking. Ghrelin is our signal for hunger. Leptin is our signal for like we're satisfied, satiety. So when we have more leptin going on, more kind of our fat cells have more to them, then we get a higher range of where we need to eat before we feel full and satisfied. And the other thing that I can say that's nice after surgery is that as those fat cells shrink, we get less leptin. So it makes us feel full on a lesser of amount of food. Always like to mention that just because that comes into play with our sex hormones. So, as I said before, we have that 50% of testosterone that can be kind of part of it, and 100% of our circulating estrogen, and depending on age of this. So just know that, like, as we have this increase in testosterone, we also have this increase that kind of increase in estrogen, because testosterone and estrogen can play in the same buckets too. So oftentimes when people will go, oh gosh, hey, I have increased adipose tissue and I actually have increased testosterone, I have increased estrogen, it's because those two can also convert with each other. And so then that makes it to where, again, think of that game of telephone. You now have a couple other different kind of people, part of that long line of signaling and that communication. I'm gonna pause here. This is such a rich subject and so individualized. And I think that's where I'm kind of like, oh, let me see where I can break this down. So I want to pause before going into what we see after weight loss surgery, to see if there's any questions or anything I can help out with there.
There is a question, Katie, that maybe this might fit in good. I had difficulty taking progesterone pill after surgery because of the size of the pill. I have stopped taking both progesterone and estrogen postmenopausal and no issues yet. And then she has continued to take testosterone. Anything concerning about this plan? I guess because the one pill, the progesterone, was too big, she continued to take the testosterone.
Yeah. So, I mean, definitely, like, I would make sure that you're getting those levels checked. Like, that's the thing that you need to look for, is that some people just will need one hormone. Like, if they're like, they just might need just progesterone or just estrogen. And it depends on where your hormone levels are. So, or I should say just testosterone in your case. So I would almost take a look and just go, okay, let's make sure that, like, where those levels are. And then the other thing is, I just always think that since estrogen has such a play in bone, like, maintenance, you want to make sure that you're taking your calcium and vitamin D to make sure that we prevent bone loss. But I would say, gosh, that's an individual question, but it's not something that I haven't not seen. Just depends on where your levels are.
Okay, hopefully we'll ask Teresa if that helped. And there is actually a question. This is something we may need to do separately, but
oh gosh, yeah.
Lori asked, could you do a presentation for healthcare professionals on this topic?
Yes. Sure. I'm like, I have before, but, you know, I think that, like, I would say, like, if there's any questions or anything I can help out with there.
So,
I'm like, I have before, but, you know, I think that's where I'm kind of like, oh, let me see where I can break this down. So Yeah, I have had for not with ProCare. I know I've done a couple different things, but yes, absolutely. This is something that is just such a, as I said, a vast topic that is really helpful. And sure, I would say, Lori, reach out to me. We'll figure this out, maybe.
Yes. And so I put my email, Lori, on the under your question in the ask a question feature, but I can get you in contact with Katie, or if I can help
Thanks.
somehow too. So
Yeah.
anyways, Katie, I'll let you kind of keep, there are some others, but I'm gonna just
Yeah. Let me get through a couple other slides, and then we'll just kind of really
we'll
have it
do more
open.
questions. I see more.
I'm
So
telling, and that's why I go, I'm so grateful, you guys, for being here today. And just know that this is like one that is like so nuanced and so individual. And that's why I was like, let's just understand this a little bit better of why we see these changes, and whoa, what happens after surgery? Like, why does this all of a sudden happen? And it's good to know a bit more about hormones and what changes you could expect or are seeing currently. So, what do we see after weight loss surgery? Again, I'm getting a lot of words up here, but I just want you to have like the information. So, we absolutely see that, like, in weight loss surgery, we see differences in estrogen and testosterone levels in females at birth, post op surgery. Okay. And so we typically see that both of those levels decrease after surgery, which is actually helpful because that estrogen can start to communicate with progesterone. And that's why we see improvement in menstruation and improvement in kind of just, let's say, like cycle improvement. And then also at the same time, we'll see those testosterone levels come down. And so, like polycystic ovarian syndrome, and then other symptoms like acne and hair growth, which is the fancy term up there is hirsutism. We'll see those actually decrease as well. And then testosterone levels in males. So we'll see those increase. Okay. And that's typically, we'll see improvement in muscle mass, and we'll see increased sex drive too. And sex drive is also, you'll see that actually too, because of the testosterone levels regulating. We'll see that also female wise as well. And then, as I said, like progesterone typically after surgery is improved because of that relationship with estrogen. And we see that kind of helpful hormonal balance and fertility overall. And you can see this really actually almost immediately after surgery. And why, in part, with that is that, like, I know I kind of did that picture of those fat cells increasing and dividing and they need to shrink. But after surgery, because we have, in part, surgery helps to change signaling. So again, I'm going to go back to that game of telephone because I think that's so easy to visualize. And let's say because of increased adipose tissue and other kind of changes in signaling, we now have a 10-person game of telephone. So our beginning message is going to be definitely different than our ending message. And what happens is that even right almost immediately after surgery, because of how that surgery happens, we start having people being taken out, or signals being taken out of that game of telephone. And almost immediately we have our lower, 6 people, 5 people, 4 people, where we want that more direct message happening. And that's why we see that change in almost so immediately, is because of how surgery works, and surgery works with signals. So what I can say is that even after a year, within that year of bariatric surgery, we see women have definitely changes in some of their hormones. And I put them all here, but just think testosterone, estradiol, which is the main estrogen, and then all of our other kind of hormones and sex binding hormone binding globulin levels. And those are all actually to help support someone's cycle and fertility. So we see improvements within a year, all of those. And then we also see improvements actually within 6 months of testosterone and that sex hormone binding globulin. Because and I think in part, I'm sure there's other changes too, but I'll be honest, I think those are the ones that are really just kind of leaned in for males. So so we see those changes within 6 months. And so lots of really, really vast and quick improvements that we see post-surgery. So I love this little kind of thing. I just wanted you guys to have it because I like to kind of go, oh, all of these terms that I said, what do each of them do? And why do we see just this mass change? And I definitely have had, after surgery clients of mine who are like, whoa, man, things feel weird or things feel new, like not weird, bad, but things feel new because there's such changes in these hormone levels. So we have improved cycle, improved menstruation, changes in that kind of like sex drive or function within there. So we see a lot of that just coming from these different things that actually are really, really helpful in both of males and females. So all across the board. So I wanted to end with like my top 5. My top 5, like how can we support hormones and continue to support hormones even after that year or after these vast changes right after surgery. And so these are some of the things that I actually think through with people. So I do think of like ground flaxseed. So I look at that and add some omega-3 fatty acids and also is a really lovely phytoestrogen. So what that means for us is that it is, if estrogen's low, it helps to raise it. If estrogen is high, it helps to lower it. It's kind of a really lovely food support that will just blend in with whatever's needed. And I look for about 2 tablespoons per day if I'm really working on helping someone like with their estrogen support. I also look at anti-inflammatory foods and omega-3 fatty acid foods. So I really do want my bright color. So I always think with anti-inflammatory or helping to reduce inflammation, I think bright colors. Okay. So that bright color in food tells me what polyphenol or what anti-inflammatory property it has. So I look for in my kind of meal, I want 3 usually distinct colors. Okay. So that might be like a dark green leafy. That might be like a bright beet that is red. I'm looking for color. And then I mentioned some of my omega-3 fatty acids down there as well if we're looking food wise. I also look at blood sugar control. So I want complex carbohydrates. So carbohydrates that take time to break down and give us that kind of bang for our buck there. And then I also think of like pairing that with a protein. So that way my blood sugars go up gradually and not so quickly. I also, with blood sugar control, look at eating frequently throughout the day. So we have fueling throughout the day. So our body doesn't go, oh, wait, I don't know if I'm going to get more fuel. Should I kind of keep things supported? B vitamins, which, definitely if someone after surgery is taking their multivitamin, you're getting in your B vitamins. But I always think through how can I help support that a little bit more. And I definitely look at those dark green leafy vegetables. And then I do think of gut microbiome. And the reason why is that is actually the last point of hormone breakdown is through our digestive tract. So when we think through of just how even, for males or females, our hormones go through this kind of cyclical play within our bodies. And so part of that is like, getting rid of or breaking down hormones and recycling part of those hormones. So it's this kind of, and as I said, it's a cycle kind of that happens. And so that last point of kind of like taking things out to the trash or recycling them is through our gut. So I do think of our digestive tract and wanting to make sure that I have that supported. And that might be through our fiber. I also did a presentation just on gut microbiome. So I almost would say check that out for more details with that. So just think like with hormones and with anything else, we want to look at the whole picture. And that's why I kind of say like, ooh, so much of this is individualized, and I will completely answer your questions the best way that I can. But with this whole person approach, like we know weight loss surgery, like definitely varies, how kind of lives will be affected physically, mentally, emotionally, and hormones can have such a big impact on all of these. So definitely as things are changing, and even as you get further out from surgery, this hormone stuff might have to be revisited as well. So definitely reach out to your healthcare practitioner. Reach out to me if I can be helpful, if these need to be taken a closer look into. So I want to always kind of put up my stuff in case I can be helpful in any way for anyone to kind of like reach out or talk to you. But I definitely want to dive in because the questions I think are so valuable with this. And as I said, it's a complex and individual thing. So I'm gonna leave this up, but Brenda, let's take a closer look at any questions.
Yeah, thanks, Katie, so much. So I'm going to kind of move back up to some of the questions that were coming in while you were talking.
Awesome.
There's some questions that maybe I can answer. So I want to just say too, there was some questions about this forum and all of that. Send me questions like that through email because those will be more easily done. But if you're asking questions for Katie specifically, we're going to kind of go to those. So I'm going to say, Gina says, like, okay, we already answered that. Oh, no, we didn't. Gina says, I currently take estrogen and have for 20 years. Will it no longer be effective, or does my dosage need to be increased?
Dosage might need to be changed after surgery. So check in on that as, and I don't know where you are in your kind of surgery journey, but yeah, so definitely check in on those levels and if that medication needs to be adjusted with your doctor.
Would it be more likely for it to be increased or decreased?
So more likely for it to be decreased, typically.
Okay.
Yeah. Yeah. But definitely I would say like, that's why I was like, oh gosh, check in. Cause it oftentimes I can say that at least in experience wise of like my years of working with people, what I see is like the first kind of like, I would say like 3 to 4 months, things are a little wonky. Like just that, like your body is trying to get used to things. So like, and I see this more with my females that they'll kind of go like, gosh, I don't even know, like my periods are really off. They're happening now, but they're really off. And then they get to this more regularity there, like as it gets further out from surgery. So it might need to be looked into a couple of times.
Yeah, and there was a question too, which I think you just touched on. The question is in the question box, but I'm not 100% sure if this is what they mean. it says it takes time in the beginning after surgery. I'm wondering if Tanya is asking if a hormone changes occur immediately after surgery, or does it happen after time? From my understanding of what you said earlier, I mean, like there are some changes I know almost immediately. Correct?
Yeah. Yeah. So, I mean, that's why, like, so with surgery, there's some things that change almost immediately. And that's almost like, it's almost like, when they do that actual cut and that incision, and either if it's like a sleeve gastrectomy or if they're, rerouting things, like all of that starts to change that signal. And I go, that game of telephone. So there's definitely changes that happen immediately. And then there's things that happen over time. Yeah. So that's why I go a little bit of both.
A little bit of both. And then we have James or Richard ask, please address post-op men greater than 65.
Yeah. So over 65, what I do typically see changes in testosterone levels. So, and within that, so that would be an increase in testosterone typically. So what someone may feel, what a male may feel is increased sex drive and increase, like typically if testosterone levels are pretty low, people will feel pretty like tired, actually a lot of fatigue with that. So usually less fatigue, and then better or I should say less like erectile dysfunction. So I'll see that in men over 65. And then like if we're looking, opposite that, I'll see more of the like muscle mass increase and along with everything else. But I don't see as much of the muscle mass increase over 65.
Yeah. Angela says, I'm 15 months post-op RNY and have been told I am perimenopausal. So I have been on estrogen patches and progesterone pills every night. With my surgery and absorption issues, should I request to have my progesterone checked after a few months? My GYN is clueless about bariatric patients.
Yeah. So, I would say that if they haven't been checked since after surgery, yes. I'm not sure when, you were put on patches and pill. And it can be, yes, like those like pills can have a change in absorption and a change in use for any like medications. It just depends on the medication and where it's absorbed and what type of surgery that you've had. So, Angela, I would get it checked if you haven't reevaluated that after your surgery.
Okay. And so there's a couple questions about attendance for this too. This is off that, but it looks like Gina and Whitney both have their emails in here. I'll send you emails and you can tell me who your program is, and then I can send your attendance to your program. Whitney says also, when should we get a bone density test?
Oh gosh. So if you haven't, bone density tests, I love, and not everyone, let's say this is my preference, yearly. Because you're wanting to check over time of how that looks. And so I love my like perfection look at this is that before like surgery, I love to have a baseline of what that looks like. And then yearly after someone has surgery. So just so that we can keep up to date and up to speed on that bone, those bone markers. If someone is a post-menopausal female, then that is usually already recommended because of the changes in estrogen levels. So they like to to monitor that. And that's separate if someone has had surgery or not had surgery.
It looks like Jane is also asking, can our bariatric surgeon order that? I would say, just knowing from the program I worked at, that's probably more of an OBGYN or a primary care.
Yeah.
Yeah. Just because bariatric surgeons are going to like get blushy and be like, I don't know what, like, not that they don't have knowledge, but it's just not their
wheelhouse. It's not their wheelhouse. So typically for those long-term, more like chronic, or what we would consider like, oh, this needs to be monitored long-term and chronic and it's far-reaching, then that's going to be like your primary care doctor, your OBGYN. Some people's endocrinologists also take a look at it too.
Perfect. Okay. Let's see. And if anybody is asking for attendance, I will go back through here too and make sure I get all of those after this live event. So
it's so much. I'm like, yeah, I know I know I got somewhat in the weeds on this one, but it's such a individual thing of what someone's hormones are doing because they're communicators. And that's that, right? Just think of it like, oh, as messengers. And usually not just one thing influences those hormones. We have other glands in our body and glands make hormones. So if we've heard of some of the familiar ones, such as our thyroid gland or our adrenal gland or even pituitary gland, those also make are part of our vast hormone system that can also influence some of these sex hormones too. And that's why there's a lot of, it depends. But what we do know is that there's changes because of those fat cells and how they kind of are part of that game of telephone. And then we also know that after bariatric surgery, because there's so many changes in signaling, we start getting a more succinct game of telephone, and lessening of also those fat cell sizes also helps to lessen their influence as well.
Yeah. I'm like looking to see if there's any other comments, making sure I'm not missing anything.
Of course. My
okay.
Goodness.
Yes. So
I would say please reach out. If I can answer anything else, I'm more than happy to, answer anything if I can, or if we need to take a deeper dive, we can. There's definitely, right? Like, and so I always like to just really approach this such an individualized way because they're complicated. So that's what I would say is like, if anything kind of comes up later, please, don't hesitate to reach out. I'll do my best to either point you in the right direction or at least, chat through with you or work with you either way.
Okay, so Katie, I guess at this point too. So also I just want to mention, once you're not showing your screen, I will share your website also.
I can stop. Let me stop sharing.
I'm gonna copy that. I have it here so that they can find you that way also as well. If they have questions or need anything. And I'll also put it on Facebook here. Katie's website. And then I also want to add here at the end of these presentations, we always kind of like do a little shout out for ProCare, our sponsor. And awesome. So we will, is it okay if I do that?
Go for it.
Actually, I want to know some of the product stuff that you mentioned, because maybe there's somebody who's wanting to do some support. I actually just ordered some of this stuff today. It's funny. We all can use hormone support. That's for certain.
Yeah.
I'm going to
Yeah.
share my screen. So one of the things too that we've been kind of sharing is a little question and answer. So I have some graphics for that first of all. We've had some people ask about our unflavored calcium citrate,
Nice.
which has vitamin D3. We rarely talk about it. So I'm going to do a shout out with that right now too as well. So if you struggle with taking capsules or chewables of calcium, we actually carry a product. It's called UpCal, and it's powdered and it's unflavored. And you can mix it almost in anything. You can mix it with yogurt, pudding, oatmeal, protein shakes, or you can just mix it with a little bit of water or milk. And it actually has 500 IU of vitamin D3, and then 500 milligrams of calcium. And I'm going to stop sharing there, and I'll show where that is on our website, along with some of the other things that you mentioned.
Yeah, for sure.
That out for those real quick. So I'm going to share my screen, and here we go. I am going to the ProCare site. So when you go to ProCare now, I'll copy this and I'll paste it in the chat box as well. When you go here, you're going to see a list of products here under this first tab, guys. And the calcium supplements that I just mentioned, the UpCal, are listed under that. So when you pop open there, you'll have the UpCal that's listed here. It comes in single servings, or it also comes in a container, which you can do individual servings too as well. So that's kind of a fun product. So if you want like a box, 80 packets, $14.99, super inexpensive, depending on how many, if you're doing, a lot of times bariatric surgery patients, it's recommended, 500 milligrams 3 times a day. So a box like this might last you close to a month, something like that. Maybe a little less if you're doing it twice a day, unless you're doing it once a day. So that is one of the things that I wanted to kind of show. And then some other products here. Katie, some other things that you kind of mentioned that I thought I'd kind of highlight here in this case is number one, B vitamins. So we do have B complex. Actually, all of our bariatric multivitamins have B in them, but sometimes people absorb a little better with the
or need some more, let's say, like more support, even temporarily sometimes. So yeah, no, absolutely, that can be useful.
And then the other product that I wanted to mention was this omega-3 fish oil, which actually that was one of the things I just ordered today. So making sure you're getting enough of, omega-3s. Your body does not automatically produce omega-3s, so it's a great supplement. You can get it through foods, but also you can get it through supplementation. Another thing is probiotics. We actually have a multivitamin with probiotics, and we also came out with this new probiotic formula that's just a probiotic on its own for gut health. So for gut health, I'd say probiotics, or would you also say fiber? We also have fiber listed under.
Yeah, I would say a probiotic or and a fiber. Those are the two things that I usually will say to support gut health. Yeah, and even an omega-3 fatty acid actually supports gut health too. Yeah.
Wonderful. Let's see. I am looking to see. I made a little cheat thing here for me. So I think those were the products that I kind of wanted to highlight. And guys, if you've never tried ProCare Health, one other thing you can do is you can go over here to this About Us tab, and there is over here to free samples, free sample button. And you can go in and you can put your information, and you can, if there's something specific that you want to request a sample of, you can type it in here. Some of these that are newer products, I'm not sure what all is available as far as individualized sampling, but usually they'll just send you a box of stuff. Okay, this is kind of like a sampler, what one of our samplers might look like. So those are some things. If you want something different, you could always ask. So that's everything I have here, and I copied the link, and I will put that in the chat box here in case anybody wants that. ProCare Health website. I'll put it on Facebook too. Anybody else have anything else question-wise before we end? Kind of quiet, everybody.
I know. It's and listen, it's a heady topic. So I know that like, whew, even for me, I'm like, whew, all the complicated topics that I at least try to break down. But there's just so much that can happen and so many really lovely things in terms of hormones after bariatric surgery. So, if you're kind of going through this, let's say like journey, and you're like, oh gosh, what do I expect for after surgery? Hopefully that helps to at least spell out some expectations. And then I would say, like, if you're after surgery, and like also if you're changing and your hormones are changing and do all that stuff, then just partner with our practitioner that can help kind of take a look at all that stuff too.
Yeah. So I think that's everything, Katie. I don't see any more questions. Oh, somebody asked, let's see. Oh, this one is about the protein powder. It says, are the protein powders tasteless? The protein powders are not. The protein powders, we have vanilla and chocolate on those. The fiber is tasteless. We do have the fiber supplement that I showed the powder on, and that's tasteless as well. So I don't think there's anything else. If you put your address in, your email here, I will go back and I'll send that to programs. So I'll do that. And I just want to thank everybody. Thank you so much, Katie, for making such a complicated topic interesting and so much fun. And to me, I've learned so much because I feel like, I was one of those people after bariatric surgery that kind of struggled with feeling just like almost immediately, those first 3 months after surgery, just feeling like my hormones were going a little bit crazy.
Yeah. And that's what I would say. Like the first 3 months is where I see where people are like, oh, there's not as much rhyme or reason. And then it does settle down. But that, like, just to confirm, that is a thing that I do hear quite a bit.
Yeah.
Both male and female.
So thank you. Thank you. And if anybody wants any specialized help, reach out to Katie. She can definitely help you. And I think that's all I have for now. So I'm going to be ending our session. Thank you, everybody. If you're watching on Facebook, thank you. And just have a great day and stay with us this week. On Thursday night, which is tomorrow night, we're going to be having a support group. So that's another way to get in attendance if you're needing that for anything. And topic on that will be a day in the life of a weight loss surgery patient. It's 5 Central Standard Time. And the link is on our ProCare Health channel, which I will post here in 1 mighty second. Copy that and I'll post it. So you can do that. And we will be changing, guys, we're changing forums here very shortly. We're going to be changing from Crowdcast to Zoom. We thought we were going to be doing it in April, but it looks like it's looking like we're probably going to be doing that in May. And that hopefully will make some things easier as far as technology. So that's what we're praying for. Other than that, thank you, everybody. And we're going to just say sayonara, I guess. I guess that's the word for it.